Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to enhance your overall understanding of information provided to you. Because when you know more, you are empowered to make better decisions and enhance yourself and your loved ones for a better quality of life. And knowledge is power. And today's topic is bringing good health to life. And joining us today is Dr. Kim Lang, a medical doctor. Welcome.
Good afternoon.
Yes, I am so glad that you could join us again. And it's great to have you back. And the last week was just such a great run, and to actually educate my viewers on homeopath, and also you being a medical doctor too for a few years. And we don't want to get out those secrets a little bit about it. So I kind of wanted to let them know that you are a licensed medical doctor and also practicing homeopath. And your website is www.wellness-lane.org. And we'll put that up on the screen for you.
Thank you.
So, yes. And so in our last session, we, talked about you being a medical doctor and also now practicing homeopath. So I'm not sure everyone was able to tune in. So if you could just briefly talk about what you did, your passion, your love, and why you decided to go into this. So take it away.
All right. Thank you, Tina. It's nice to be back. Yes, as a physician, which is my second or third career, I realized I needed to know more.
Oh.
So I chose to go into homeopathy and studied that here. There's a great school, so those of you who are in the audience who are interested in learning more, the Northwestern Academy of Homeopathy is actually one of the top rated schools in the world, and it's right here in this city.
Wow.
So that's pretty wonderful. And in doing homeopathy, I found that I could do things I couldn't do as a medical doctor.
Okay, yeah.
So I love it.
Yeah. And so with all of the background with both, medical doctor and being a homeopath, that will benefit even your patients even more.
Mm-hmm.
So
that's the hope.
Yes, exactly. And to treat the patient, and that is our primary person that we want to help them help themselves.
Mm-hmm.
And that's kind of what you are actually presenting on the show today.
Yes.
Exactly. That's good. What type of people come to you?
Well, there are a lot of people that come to me. Those who I see most often either have been to the medical doctor route and have not been helped,
Okay.
or they've taken the prescription and they've had a reaction to it,
Oh.
or and they're allergic to it and they can't take it, or they have so many side effects that they don't feel well on it. So those folks will gravitate to other health and healing modalities, and homeopathy is a great other choice. And then also people who have, a bent to do things more holistically, and they don't want to take medications. That's another group that I see that comes to me. Because homeopathy is a scientific medical-based practice that does treat the whole person using remedies which are energies of anything from the earth. So it's very different than what I give as a medical doctor, which is a material substance. Actually, most of our prescriptions are from the earth. So they're the same, but it's a material dose or milligrams or grams of something, whereas in homeopathy it's the energy, which is a different way of healing.
Okay. And sounds like it's a very natural way and to put something back into the body that the body won't reject.
Yeah, I guess, or it stimulates the body and reminds it that it's reacted to something before that gave all these symptoms, and then the body can rebalance in hopefully a healthier, more functioning way for the patient.
Yeah. And let the body do its magic. That it is.
We want to be healthy.
Exactly.
Yeah.
Yeah. And I know as I get older, that's so important to me, because of where I want to go and the health issue, and also being around and being able to do all the things that I love to do. And skiing and having a good quality of life is very, very important to me.
And now that you've earned all the wisdom to get there,
Yeah.
I mean, you want to use it and be able to use your whole body instead of have parts not working for you. Yes.
Yeah. So we're just talking about, our destination and where we may go in our path. So in regards to some remedies that you might have, or even some examples that you could give my viewing audience?
Well, I can think of 3 people that came to me that I wouldn't know how to treat as an allopathic physician.
Okay.
The first was a 9-month-old infant who would scream whenever she was put in the car. And, you know, in the car you're facing backwards as an infant. And she would scream at bedtime. And she had never, ever been hugged. She wouldn't face forward, so you had to carry her, so she was out like this, you know, you carry her facing away. And her mother would have to dance to loud, wild music to get her to sleep.
Oh.
And that would be kind of old after 9 months. The other issue the mom had that was more recent was she had rotavirus, which is an infection a lot of kids get, and she had it twice and had antibiotics between, but ever since that, the last 3 months, her gut's not been right, so she'd eat and it'd get bloated and hurt, and then more pain for her.
Okay.
The other patient that I think of that was a neat example was a young woman who had been disabled for about 5 or 6 months when I saw her with MS. She couldn't hold a pen. She'd have a pen in her hand and it would shoot off into the and she did that while she was in the office. It just shot off across the room. Well, she also had right leg weakness and needed a cane. So her whole right side was affected. She couldn't write a word. All the letters got mixed up, almost a dyslexia. And she was in the legal profession, so she couldn't do her job.
Wow.
I mean, because all of these things were part of her MS. In addition, she was incontinent of urine, so that's not too cool when you're just a young person in your 40s.
Wow.
And the last person that I think of had high thyroid, hyperthyroidism, and wasn't tolerating her medication. So those are 3 different people, 3 different diagnoses, and as I say, as a medical doctor, I wouldn't know how to treat those.
Right. Yeah.
So those are a couple examples of kinds of folks.
Wow. That you've treated. Okay. And then, so can we go back a little bit to the infant then? I'd like to have you kind of go into more detail on that, if you could, please.
Sure. Well, I saw her probably April. She got her remedy April, May, and you know, it was just little pellets like this. Now, this isn't the true medicine because this is arnica, but she took 3 pellets, 12 hours apart, just 2 doses.
Yes.
The end of April, first part of May. And then when I planned to see her back kind of the end of June, I saw her back and her mom said she was sleeping mostly through the night. A couple of nights a week she'd wake up screaming.
Oh,
and her gut was better. So she still was having sleep issues and the behavior with that. So I gave her the next higher dose, which is actually less.
Okay.
Less is more in homeopathy. So she got a 200 C of lycopodium.
Okay.
And I gave her a 1M, which is 200 C is 1 over 100 to the 200th power. So you can figure out how many zeros if you'd like.
Okay.
And a 1M is 1 over 100 to the 1000th power. So there's really just the energy of the plant. She had 2 doses of that. Her mom made an appointment also to see me the end of July because of vacations. We couldn't see each other for a month. She called me in 3 days in tears and said my daughter hugged me for the first time in 10 months.
Oh my gosh.
She had never hugged her parents. And she was sleeping. She rode in the car without crying and screaming. Her gut was fine. Her mom called me the end of July and said, I'm fine. I don't have my anxiety, depression issues. Well, you think she slept. She hadn't slept for at least 10 months, probably the 2 months of the last of pregnancy too. So she hadn't slept for a year.
Wow. It's
going to make any of us, you know, have anxiety or depression.
Sure.
So then I didn't hear from her for a long time because she was well.
Yeah.
And I said, well, just call. And she called in December. Her little girl, now about a year, had caught, well, a year and a half, year and 4 months, caught a cold and the symptoms came back. I said, repeat the dose once. So she just gave her 1 more dose. I didn't hear back. And then I happened to talk to the mom in September of this past year. So now we're a year and a half almost from when I first saw her.
Okay.
How's your daughter? Fine. There's nothing I have as a medical doctor that could do that.
Right.
You could drug a kid. You could give a lot of stuff for gas and bloating.
Yes.
You know, she had the antibiotics, she had the usual treatment. Nothing. And she had, what, 2 treatments April, 2 in June, 1 in December.
Wow.
Amazing. So it's hard to say homeopathy is a placebo effect.
Yeah.
Because this little girl's not going to know that.
No.
And the parents certainly are appreciative they get hugs now.
Yeah.
Homeopaths will say allopaths, which is the medical doctors, suppress symptoms.
Okay.
And, you know, they're very different. The homeopath is like treats like. So we give something that in a healthy person would give the symptoms that the patient has.
Okay.
So if you have high blood pressure, you'd actually get something that would raise blood pressure in normal people. But it tweaks your vital force to lower pressure. In